Okay.
Hello, everyone. Hi there. I'd like to welcome you to the Genesee County Maternal Child Health Network presenting the Doula panel discussion. I'd like to thank the network that coordinated the Genesee County Health Department for all they've done to get this together. My name is Lyric Walsh. I'm a nurse midwife at Hurley Medical Center and a huge fan of doula care. I would like to just start with a brief talk about doulas and the word doula. It's an ancient Greek word that means a woman who serves, which is very appropriate for all of our goals for serving women who are families having their babies. This current time, doula is a professional trained provider to provide emotional, physical, and informational support to the woman in the family, specifically related to pregnancy, labor, birth, early postpartum, which can include breastfeeding care. So it's a big time in a family's life. So it's very nice to have a professionally trained person to walk that journey with them. Sometimes people confuse the doula and the midwife role, and they are definitely complementary, but distinct. And I know we're going to get into that more with questions, but I just wanted to start by saying hello and welcome and introduce our panel members. To my right here, we have Deanna. Would you like to introduce yourself?
Hi, thank you for joining us. Thanks for inviting me to be part of this panel. My name is Deanna Charest. I'm with the Michigan Department of Health and Human Services, and I sit in the Division of Maternal and Infant Health, and that's where the Doula Initiative currently sits, and we do a lot of work, or we're starting to do a lot of work around doula access and in light of the Medicaid policy that was effective in January, allowing doulas to be reimbursed through Medicaid.
Hi, I'm Shonte Terhune-Smith. I'm the owner of YOLO, which means You Overcoming Lactation Obstacles. I work several other jobs as well. I won't go through every single hat because we'll be all day, but I'm a lactation consultant and a birth doula, childbirth educator, and postpartum doula.
Hi, I'm Katie Jolly. I am the owner of Mother Heart Birth Services. I've been a doula for about 9 years now, and I also offer similar services such as birth photography, placenta encapsulation, and I'm also a certified lactation counselor, and I'm happy to be here.
I'd also like to say Shakira Wheeler, a birth doula, at the last moment was not able to be here tonight. So we're sorry to have her not here. So we've had some people submit some questions, which is pretty exciting, but I just wondered if there's any questions here in the audience someone's burning to have answered. That's okay. I wanted to throw that out there for fun. Ladies of the panel, can you talk to me about what it entails to become a doula?
Absolutely. So typically a doula will participate in like a training of some sort to get started. It's usually in person, but now there are many virtual options as well. And they are usually including like a weekend or a few day workshop to begin. And that covers like introductory pieces to the role, as well as some hands-on instruction for like the comfort techniques and things that we provide to laboring patients and clients. after that, doulas can choose to become certified, which many do. So beyond training, they are fully equipped and ready to take on clients and provide that service. But certification can include assignments, books, evaluated births, evaluated by both the family and the provider that is providing the medical care, as well as just a bunch of reading and continuing education. And anything to add?
Thank you, Katie. That was really informative. So what to expect when you become a doula? Tell me about a day in the life of a doula.
Okay, I'm not gonna make it sound glamorous. It depends, I think. I think it depends on if you have kids. I give myself 2 weeks before, 2 weeks after the due date to kind of feel like I'm on call, on higher alert. It could be me door dashing somebody before I walk out the door, making sure people can eat while I'm gone, and then shooting to the hospital. It can depend on like when I leave. Are you in active labor? Keeping me posted. What does that look like? If Katie is grabbing the placenta for me, I let her know that whoever is in labor. And then just being there until we deliver. It depends if what else happens. If you're resting, I might go somewhere and cop me some sleep as well. Typical births, I feel like I at least expect 10 to 12 hours at least. Um, Shockingly, I've had like hour, 20-minute births delivered before I can make it through the door type of situations. I give myself 2 days to rest after a birth, depending on if it was those types of births. I've been at a birth for 2 days before. So I think it just really depends on the situation. I give myself longer grace, especially if it's the first time mom. And so, yeah, I always make sure I bring snacks, water, toiletries with me, money to go be able to go eat. Somebody that can support me and bring me if I need something else while I'm there. And yeah.
Agree with all of that. So I would just add that doula support usually is very like fluid day to day, just because we do tend to take on more than one client at a time. So when someone reaches out to us, they'll let us know when their due date is. And most of us in the profession will have like a certain number of clients that we'll take on per month or around that same due date, just so that we can try to guarantee our presence as much as possible. So we could have, like, on a given Tuesday, we could have a prenatal visit with someone who's 20 weeks along, and we could have a postpartum visit with someone who delivered 2 weeks ago, and we could have a new inquiry calling and answering emails or texts from someone who's signed on with us, so it's just kind of like keeping tabs on the people who we are contracted with to support. And then, yeah, I mean, the culmination of being at a birth, but that's not an everyday occurrence. So just providing that support prenatally throughout their birth and postpartum.
The question is, how long afterwards do we do as a doula see someone postpartum?
I at least do 2 check-ins after a birth. It's always more than that, but I at least do like follow up a couple of days after you're home. I'm always asking like how things are going at the hospital, but at least 2 appointments afterwards. We can space them out how the family wants, but like a week at first, and then at least 2 weeks after that. And because of my breastfeeding hat, it's usually more than that. So it's usually, I want to say like a 6 week, a 8 week. I like going earlier, like the first week or two, because sometimes we can catch things where they might need to go back and see the provider sooner. So I always feel like the sooner the better. And some people prefer text check-ins, which I feel like a lot of moms prefer. Um, so I'm totally fine with that, but I'm always asking like how they feeling, how they're taking care of themselves, what the newborn appointment look like, what their bleeding and things like that are looking like as well.
Yeah, I would say for me, it's a lot of text check-ins, like she said, especially shortly after, just trying to catch them at critical times, like, oh, just so you know, baby's second night can be a little bit of a doozy. Here's what you might expect. How are you doing? Did you make it home? What did Big Brother think of the baby? Just continuing that care and that relationship. And like she said, helping field questions as far as diapering, bathing, feeding, the postpartum transition. And then in person, we also kind of mention and keep an eye out for any sort of like postpartum mood disorders or any sort of red flags that they could look out for, and just kind of be there in between the birth and if it was a hospital birth, like that 6 week visit, or providing the continuity of care with their home birth team or whatever that looks like.
It's interesting you brought up postpartum depression, because when expectation is here, in reality is very far over here, that's when we're really at a higher risk of postpartum depression. And with the prenatal information provided by doulas, it can help them have a realistic expectation and maybe smooth the point to reality. So, and also another pair of eyes to say, are you feeling yourself? That's really helpful. So women don't lose so much time of that immediate time with their baby. So doula sounds like they give a lot. Talk to me about doula self-care. How do you keep going and going?
Like I just said, I would give myself 2 to 3 days after a birth. Katie and I both have births the same, like multiple births in the same day. Those are fun. I think I learned early on, like I think when you first start, like you're really ambitious, like, oh, I'm a doula, you want to take over the world, and you are really motivated, and you think I'm like, oh, the goal is to have all these clients. And my first year, I had like 23 births, and it was Nicole who tapped me on my shoulder. A midwife tapped me on my shoulder. Was like, Shonte, that was a lot of births for you, considering everything else I had going on. So now I have a rule where I don't take any births around Thanksgiving or around Christmas. So I don't take any November, December births. Last year they caught me slipping because I had a couple of people were like, please, but they delivered before Thanksgiving, so I'm grateful. But I don't take any births around Christmas. Because I think sometimes, like as a doula, you give, and you got to remember like to fill yourself back up. And we have family and stuff too, so I try to be fair to my kids. Like I can't be out here helping everybody else deliver, and I'm not taking care of the little people that I got. So I try to make sure I prioritize that. I give myself a block in the summer so I can vacate and not think, what if you go into labor while I'm out of the state? So I try to make that August, and plus my birthday's in August, so I try. So I think we keep each other accountable too. Like we know when we're burning out or when people get sick and all of those things, giving ourselves time or asking, can you cover me because I'm sick or I got sick kiddos and those types of things. So realizing like the last 2 years I've been setting a number. I tell myself the number. I don't say it out loud to anybody else what that number is for births. If I put it on social media or something, maybe I'll get a flood. So I don't want that to happen. So I set me a number in my mind, like this is how many births I'm going to take, and that's all I will do. It won't be 23. I will tell you that. So I've learned my lesson about burnout, because eventually, like births, like even though we aren't the ones birthing, like we are active, like we're helping with pain, we're moving around, we're supporting the partner, we're helping the nurses. It's a lot that, and we're woke most of the whole time, even if that person is sleeping. So just being mindful that it's going to take a lot out of you. So yeah.
I'm the worst at self-care, so I'll take suggestions. And my kids are trying to convince our family to get a hot tub because I get pretty sore after all the hip squeezes and comfort techniques. So I'll also accept donations to the Jolly Family Hot Tub Fund. But I would say my biggest self-care is my fellow doulas. We have a lot of doulas locally that we just text each other. I had this really tough birth. Can we just go over it and kind of talk about it? Or I had this really great, we call it sometimes like a butter birth, like you have to celebrate with me. It was so fantastic. Or this mom had this, VBAC, this vaginal birth after cesarean, like you'd be so proud of how great she did. And so I think having people who get it, and I think that's just super helpful for me. And then just trying to remind myself of my worth and focus on equitable compensation makes a big difference as well. Because if I'm going to be, missing out on important moments with my family, then it needs to be worth it. So I think that is a beneficial thing too.
If someone's interested in a doula, what are the referral revenues or avenues that that they have to get a hold of you ladies?
Social media. I've had a lot of people tag me like when they say like, oh, people ask what is a doula and should they get one? And if they're like, okay, I want to get one, then usually somebody attack you. Word of mouth is amazing. It's still a thing, even though I know we live in social media land, but like people will refer, people will inbox through Messenger, the website, having yourself Google ads can be helpful. Information at the doctor's offices, of course, referrals that way. So sometimes people learn about us through their doctor or midwife. It just depends, or just people having traumatic births before, and then their friends saying, "Hey, you need a doula," and then they'll say like, "These are the ones that I know." I know sometimes if I can't take a birth, or if people are looking for people who are experienced at other hospitals, like Katie has birthed in Ann Arbor. I haven't birthed in Ann Arbor yet. So if it's somebody and they want somebody with that knowledge, then I'm like, hey, I'll refer you to Katie. So sometimes we'll have people reach out through other avenues, and it's all about connecting them to, I think, the right person. But word of mouth, and people looking for better options, I think, is how they connect with us. There are some new websites.
Mhm. Yeah, I'd say that's where I get most of my inquiries is I think people just type doula near me and my website will pop up. So I know that as far as like Medicaid covered doulas, there's a registry forming. So I think that's kind of gaining some traction. But I think for now, most of it really is just searching. There's this website called doulamatch.net. Sometimes people find that to be successful, but I think a lot of people don't really see that one very much. So it's really just kind of stumbling across it and searching for it and word of mouth and referrals.
The highest compliment, I'm sure, is when a family refers another family to you. That makes very good sense. In my early days of being a midwife, there was like DONA was how you became a doula. Is that still like the top training organization, Doulas of North America?
I would say it's very widely recognized, but definitely not the top. I'd say there are tons of avenues to become a doula, many organizations and many like mentorships and stuff like that. DONA is definitely a long-standing one that a lot of people know about, but people choose the one that resonates the most with them, or that makes the most sense for their community, or the one that has the next training or nearest training. So there are lots of different reasons to choose different organizations. I personally chose a different one from DONA just because of some things that DONA, they had a few different like restrictions that didn't quite fit for how I wanted to serve families. But I know that lots of people do choose that one. So it's definitely a quality organization, but lots of options.
Very nice. Thank you for that. I do want to hit on the difference between a doula and a midwife because I think it's an important distinction. A midwife is a healthcare provider. They provide medical services like prenatal care, the birth, postpartum care. There's an infection where doula is a non-medical provider who provides, as we talked about earlier, like information, emotional support, spiritual support. Some of that can cross over with information, but a midwife who has a doula at the birth is a very happy midwife, for sure. So something that's really important to me is to talk about sometimes the elephant in the room, healthcare disparity, and the differences in color of providers versus patients and how that can impact outcomes. Do you have thoughts on that, or would you like to address any cultural sensitivity things?
How did you phrase the question again? I want to make sure I answer it correctly.
I think I just want to pick your brain about like how you address cultural sensitivity, because women of color, I think historically, when I was doing some reading about doulas, didn't have access to doulas.
I think the biggest thing with some women of color, they didn't like having a doula seem like something you do if you made a certain amount of money. Like it's almost like having a nanny. Like, can I afford that? It didn't seem attainable. And then I believe over the last few years, with the losses in maternal health with women of color, I think more people started to make it more like try to educate Black women more about like, hey, take better care of yourself, get a doula, get a midwife, home births, like all of this education came out more in social media. I think what stuck out to me the most, I was in a birth, first time mom, everything was going to the crapper. I'm not gonna lie. Everything that you thought could go wrong was going wrong. And then she finally had the baby, but stuff was still going wrong after that. And even though it was most of us in the room were Black, she said to us, like, don't let me die. And like, I was like, dang, like you really, in that moment, I really realized like how heavy it really is. And even though the OB that was about to take care of the situation, he was Black, she looked at him again and was like, don't let me die, because she was gonna have to go back for surgery. And it was just like, man, that's how much Black women are impacted by the healthcare system when it comes to giving birth, and how scared women really are. So I think having a doula there really helps. This family had another baby. I was shocked I was invited to be the doula again because it was a traumatic birthing experience. I'm like, she might think I was part of the trauma, but they actually had me come back. The second birth was a much more smoother, beautiful birth. I was so happy for her, and she was so empowered by the outcome. But it's real. Like people don't think women really carry that. Black women don't carry that with them into birthing situations. And just because they aren't verbalizing it, it's a really scary thing for them. And so I think having somebody there, especially somebody who's not family, but not saying Black women have to have Black doulas, but sometimes that advocacy there, knowing that somebody understands you, like that representation, improves their overall health because you're not stressed. You trust this person. You believe it'll be better. And so I believe that aspect of it is helping like Black women feel more empowered in their birthing experience.
Yeah, not a whole lot to add to that because that says it all. But I think for me, it is all about personally doing a lot of work, a lot of anti-racism work, and a lot of listening and hearing my clients. And I am very intentional about the way that I choose pictures for my website. I really want families, especially families of color, to know that I am working every hard to be an ally, working every day to be an ally and use my power and privilege to help their voices be heard. Because as a doula, a lot of people think that we will like speak for them in our advocacy in the labor space, but really it's all about empowering them and their voices to be heard. So I'm just very like mindful of that and making sure that especially if I'm working with a BIPOC family, that they are being heard every step of the way, not having anything being discounted. And if it seems like it's heading in that direction, I'm using my voice and I'm making sure that it's always putting the ball back in their court, so that they can feel that empowerment that Shonte mentioned, so that they can be safe and be heard. So that's important.
I was just going to add that your guys' responses are way more powerful, but just from an evidence standpoint, the research, I mean, is overwhelmingly supportive of doula services in general, right? They improve birth outcomes, they reduce cesarean sections, higher breastfeeding initiation rates, improved mental health, better birth experiences, but particularly the research has shown a huge difference in with birthing persons of color. Obviously, when they go into a birthing situation, they're facing a system that has been built on systemic racism, and all of those things built up, and a doula can't fix any of those things, and they shouldn't feel like they should try to fix those things. Those are way bigger. But having a doula there with that family to be another voice and support them, really evidence has shown has made a big difference, especially with community-based doulas.
Thank you for that. In 2013, Listening to Mothers did a national survey and found 6% of birthing mothers received doula care during labor. I want to kind of ask if we can talk about how 2013 to now, how are we improving that?
Say that one more time, I'm sorry.
Oh, since 6% of women were having birthing doulas 10 years ago to now, what things are out there to improve access to doula care?
I'm on. So again, I'm from MDHHS. I just wanted to talk quickly about some of the things that are happening at the state level, even though most of the work happens at the local level. We all know that. But we're excited that effective January, there has been a Medicaid policy that has allowed for doulas to be covered for Medicaid eligible families. That's huge because typically services in Medicaid are only provided to licensed individuals. And so our office has been doing a lot to try to support that work and really support doulas who are interested in becoming Medicaid enrolled, because it's a choice, obviously, for each doula, whatever works best for their practice on whether they want to explore that. So we've just been working hard to make sure that there are resources available and technical assistance to help doulas. Katie referenced a doula registry, which we do maintain in our office as well. And it's kind of like the first step to becoming Medicaid enrolled. There's a list of approved MDHHS approved trainings that an individual has to have completed in order to kind of be put on the registry, to be part of the registry. And then there are obviously additional steps that somebody would need to go to be Medicaid enrolled. Spoiler alert, lots of steps. But anyway, getting on the registry is the first step. And I'm happy to say that you mentioned DONA. DONA is one of those trainings, but we've made it a priority to approve some additional trainings because we know that is not, as Katie said, the best training for every trained doula in the state of Michigan. And we want as many people who are trained as doulas to be able to be Medicaid enrolled and serve Medicaid eligible families as possible. So I think there's about 13 trainings that are on there now. And most recently, the ones that have been added are community-based trainings that doulas of color throughout the state have indicated that would be important for them to be added. And then some trainings that Indigenous doulas traditionally have taken. So we're just trying to make sure as many doulas in the state can be Medicaid enrolled as want to be. Okay. So in addition to that, we have formed an advisory council, the Doula Advisory Council. They're actually the body that approved the trainings because they're the experts. We're not the experts at MDHHS on doula care. So we made a lot of efforts to have a diverse council as possible. We have statewide representation. We have extra representation from Indigenous doulas because they have some Indigenous doulas have a unique situation where they have never went through a formal training, like doula services are passed down through their traditions and customs. And so we want to make sure we hear their voices and eventually, we're not there yet, find some path forward for doulas to have kind of like an experience pathway to maybe, being approved for Medicaid and be able to be Medicaid enrolled. So the council, beyond that, we worked really hard to make sure they were diverse as far as experiences. We have doulas that are specialized in serving disabled individuals or people with disabilities. We have doulas that specialize in LGBTQ families, doulas from all the various specialties that exist, and then obviously statewide representation. And so that is the council that is reviewing the trainings and approving them to be added to be MDHHS approved. We expect them to advise us on a whole host of things, policy changes, resources, continuing education, what's working, what's not working as far as doulas trying to be Medicaid enrolled. And so we're really happy and we're really thankful for the doulas that volunteered to be part of that advisory council. In addition to that, we this year are going to be sponsoring some trainings for people throughout the state who want to become doulas. Obviously we have, we have this policy that's been in place, but we recognize that there probably isn't a doula workforce out there already to implement the policy. So we really want to try to help people who are interested in being doulas get trained. I don't really have anything to announce yet on that because we're still kind of formulating it, but I think it'll probably be between 5 and 8 doula trainings that we'll be able to help sponsor. They will need to be part of the MDHHS approved list, but we're also happy that we can offer stipends to people who want to take the trainings because we know training time is time away from work and your other ways of earning money and supporting your family. We have a website with lots of resources on it. Really, we understand that, like healthcare and Medicaid is complicated for anybody, like all of us only half understand our healthcare coverage, if I'm being honest, even people that work in, in the industry. And so in addition to that, like all the nuances of like learning how to bill insurance, learning how to contract with Medicaid health plans, learning all those pieces we know is going to be a heavy lift. So we're just trying to develop as many resources as we can to make it a little bit easier. for doulas that want to serve Medicaid eligible families, but we've got a long way to go.
I was excited to read today that the IRS recognizes doulas as something that can be used with a health savings account or flexible spending account. So that's another access to decrease the barrier to cost. An interesting side note, one of the questions that was proposed was doulas are independent contractors, right? So the impact of having a doula with a birthing family, talk to me about that when knowing that the doula is not an employee of the hospital. Would you like to speak about that? How that can change, impact the care?
I guess this is a good one for me since I work at the hospital too. Um, I always tell families upfront because majority of my families birth at the hospital. I tell them, hey, I work for this hospital. But I want you to know that when I'm there for you as a doula, you're contracting me as Shonte with YOLO. I don't work for the hospital when I'm there with you. Everybody knows I'm a rebel anyway, so it's kind of like, I'm gonna say what I'm gonna say. I'm gonna do what I'm gonna do in the best interest of the family. And so with that being said, with the new Medicaid reimbursement for doulas, that is one of my concerns, is that healthcare systems will start to hire doulas. And then to me, once they start hiring doulas, you've taken away that power of community-based doulas. And I think that's where the strength comes from for families. And even though I know it will sound great, like, oh, but I really work for them 40 hours a week and plus this or that, somehow the systems are going to make money off of that reimbursement, in my opinion. So I just feel like that could possibly taint the work of doulas. Because if you're working for the hospital, if you in there, everybody's in there and they looking at you like, you work for us though. So yeah, sometimes where I'm like, hey, if you feel this is off, we gonna say that it's off and we gonna tell them that you feel off and I'm gonna go get whoever and we gonna keep saying that you feel off. Are you gonna do that if you work for them? It's the conflict of interest. I just feel like it won't work like that. And so I feel that's where it's gonna go. But I really feel like this is something that should stay community based, and whether that's like a collective of doulas and us working together, and like I want to say in companies where it's like a team of us, because I mean, I'm not a spring chicken like I used to be. I mean, I'm still young, but I'm not, doula work after a while, as you start to get older, is gonna wear on you more and more. So mentoring and being there for others and showing them the way. And if like Katie and I talked about this. Like if we already are well established and people know us, bringing another doula up under us and us showing you how to promote your business and make connections and stuff like that, I can still get satisfaction from that because you still gonna serve families. And so I think it's a way that we can make it sustainable in the community for us all without us having to give over what makes us so passionate about being doulas to a bigger system. That's how I feel about that. That was my soapbox, you see, but yeah.
Yeah, I would just add that by having a doula free from like affiliations, it adds a lot of freedom for the family. So most birth doulas will attend both hospital or home births. Some doulas do have like a boundary where they might not attend an unassisted home birth that's not attended by a home birth midwife. But if we were affiliated with a hospital, that would limit our services to only hospitals. Whereas we can go to freestanding birth centers or birth centers that are part of hospitals or homes. And that's very important to us because families need and deserve that choice. Also, you just never know how things are going to go, right? So if like, for example, if I have a family who's planning this beautiful, like unmedicated vaginal birth after cesarean, and then partway through their pregnancy they discover that that provider is actually not supportive of that, they might switch providers, and because I'm not affiliated with that provider, I carry on with that support. Or I had a client once who was planning a hospital birth, and she was a sexual abuse survivor, and all along the provider said, we guarantee no male presence in your delivery room, we promise. And then at 38 weeks, they were like, oh, whoever is going to be there is going to be there. You just have to deal with it. So she immediately switched over and had a gorgeous home birth. Again, my doula care carried on. So I think it's really crucial to have that separation, because we can provide that continuity of care. We can kind of help to be that like go between. We don't, like Lyric said, we don't provide any medical care, but we can kind of help interpret it so they know that there's a friendly face in the room. We can kind of help to help them to understand what's going on in a way that makes sense and that's unbiased.
So do you think that would be able to do what we were to tonight that we can help them?
You want me to repeat it so people can hear? So she was asking basically, like if I were,
So we had a patient again.
mhm, mhm. I mean, I definitely think it could be a possibility. There are always, regulations and red tape and stuff that can arise, and it is pretty unpredictable. I mean, we saw that happen even with COVID, where for quite some time, doulas weren't seen as part of the care team, and it was really a fight to get back into that birth space. So I wouldn't be surprised if something like that happened, where yeah, we were transferring and someone said we couldn't go, or I mean.
I don't know. I think the other part of it too is like how you were saying about the provider and then switching it up at the last minute. I think like the thing about having it as community based too, and you after you do so many births and then you get familiar with certain providers, is if we work for the hospital, if I say to you, you don't want such and such, he's C-section happy. And like, if you come to me and you want me to take you on as a client, and I know, like how she said, these are your birthing goals, and I know 9 times out of 10 of what it might end up as, and how would the hospital feel knowing possibly if I say don't have such and such, but right, but even if I refer to you in the same system, it's just not that office. That provider would be like, she out here telling people A, B, C, and D, which it shouldn't be an issue. You should be handling what's going on with that provider, but instead you'll say, I'm ruining money for this provider. And if I work for you, what you gonna do? You gonna let me go? So the conflict of interest is real. So yeah.
The question that I have pertains to what you're talking about is, how about if we contract where it was something to explain if you connected with the hospital and they had to come alongside you and not you coming alongside them. That's where it makes it more still stand alone, but then there's still a connection. And that way you have, you know them, right? But you have that conversation with the one that you don't know. And it's put in place that this is what happens when we come in. Sometimes I believe that when we put ourselves in a position with people that are in a higher hierarchy of doing things, and we show them something, it makes them have to up their game. I'm talking about that. I'm just saying.
So, because I'm a rebel and I'm gonna say what I'm gonna say, I had a provider call me today, to check me about something that I said in lactation land. I was 100% correct about what I said, but she tried to tell me what I should and shouldn't be doing with her patient as far as lactation. Your patient sought me out. Them being your patient don't have nothing to do with me at this point. But the fact that you trying to control what I do in my business and I don't even work for you, but because you are a doctor, you telling me what I can and I cannot do. So just think, we not even contracted. So what you gonna do to me when we are contracted? And for me to have my own business, and I have like quite a few organizations who are contracted with me. Oh, the red tape is very real. Even if you're trying to say, well, this is you still you. I really have to comb through things because of that. And so I'll just say it. A lot of providers feel like they have the power. And me as a lactation consultant, licensed, been doing this for years, I still get a lot of flack and no respect. And so if you think about doulas and people look at us as we're just birth sidekicks, or you might as well have your mom and grandma in the room. If you think that of me and I'm licensed, you really think that of doulas as well. They come and play, but this is still their healthcare system. The contract don't got nothing to do with the state, like, so.
Like those different things that we have to learn along the way. It's sometimes someone that's in the machine. You know, I know what you're saying. I know exactly what you're saying. But when the more that come together and say, hey, look, this is how we're gonna put this together, and this is how it has to be, whether you want to accept it or not, this is what the state says that we have to do. You know what I mean? It's different when a entity, even above them, that gives them their life, says, that's why I'm.
But I'm saying, why can't I just be me? Why can't, I'm saying we need to give the power back to the grassroots. And that's where we all went wrong. The healthcare system wasn't set up for us to win. You know what I mean? So it's not set. So my thing is, why am I going to give you the power in a situation where you already have made these, especially group of women of color, powerless? So to me, they shouldn't get that power in what we do with our.
Power to you. Because what it's doing is, and it's not like, I hate to see the power struggle, right? I get that. But when you're working with people and they're helping each other, whether you agree with it or not, the patient is the one who has the last say in their care anyway. They can cut that doctor off in a quickly, right? So that doctor needs to be working with the people and working with the patient, because that's what keeps that continuity of care together. That's just my thoughts on it. Because where I sit in some areas too,
No, but I get what you're saying, but I still feel like, why do we have to give anybody the power? Doula's been doing great on their own in the community, but now that we've all of a sudden switched up how we're reimbursing them, which is still not 100% equitable, no shade, right? But but it's still not what we deserve. Because if you think about it, what we getting reimbursed, and you got to think about how many prenatal appointments we doing. I know doulas who go with their doula clients to every prenatal appointment. So think about all the things we do that's extra, that's not included in that reimbursement. So even so, if I can sit up here and charge what we were talking about, how much some new doulas are charging. If I can sit up here and charge $1,200, and I know what I'm worth, not in an arrogant way, but I know what I'm offering to families. And then say if I'm only getting reimbursed $700 and you saying contract with whoever, I could still potentially be better off on my own, still having the rights to how I want to run my business, not worried about nobody's red tape. And then a lot of people, it's still about trust factor too. who do I trust? If this system has caused harms for hundreds of years, why should I go back to trusting this system where Katie and Shonte have been trusted for 10 years and they having better birth outcomes? Like, to me, that's where my head is at in it. But that's because I'm passionate about that side of it, because I believe in the power in the community. I believe in the power of trusted professionals.
Yeah, and I was just gonna add that, I mean, we fully recognize that every doula is not gonna choose to be Medicaid enrolled and bill, you know what I mean, like, go through this process. It's an individual choice, and everyone, should make the best choice for their businesses and their clients, and, I don't know exactly how things are gonna transition, but I do think it's important that we never lose sight of, like, that doulas should be working for the family. You know what I mean? Like, I think that is important, that we have to maintain that, and, I don't know the best way that'll happen, but I think that is critical.
You had a question and then you had a question, so we'll start with you. Okay. It's nice to know that we have someone with that kind of background as part of the push. What was your question? I'm not allowed. Mhm.
No, you didn't think I was saying I would want them to be. Oh, I was like, oh no.
I do want to say, I've noticed there's different types of doulas. You've got birth doulas and postpartum doulas. Would you guys speak to that, please? Oh, I'm sorry, I didn't see your hand.
Several questions, but, I think it covered a lot of this. But I would start with you. Doula rights. Is there a governing body? For ensuring doula rights? Honor and respect.
Can I add? Because I know I'm a bit of a rebel. You might be like, oh, she got hot. But I will say that I respect any doula, and I didn't say if I did or not sign up for the Medicaid. But I respect anybody, because I mean, there's times we do sliding fees and things like that, or I've done free births. So rather, if you decide like, I would rather not take a free birth, and if you got Medicaid, at least I can get something instead of nothing at all. And I totally get that. So I just wanted to clarify, I support any doula with the decision that you make, but I do want all, if you've been a community-based doula, because there's a whole lot of new doulas in the field, like a lot of new doulas. But if you've been community-based, to just think about, how it impacts your business and just how in the future, how you want to move. I've already started thinking about it because that's just me and how I think of like healthcare systems, period. But I just challenge everybody to think about that as a whole. And to, if they see these conversations coming out down the pipeline, nobody can say nobody brought it up and we didn't know how people felt either. So.
Oh, sorry. Okay, so two more. Are there support networks for people? And then the second question is, what is considered?
So the question was, are there support networks for doula? And what was the second one?
The second was, what is considered equitable pay?
What is considered equitable pay? Okay.
All right, so as far as support for doulas, in case you didn't know, did y'all know about the retreat? It's a doula retreat. Yeah. Okay. See how being on call, I can just throw off everything. So there is like, because that's becoming more of a thing, like where we are and seeing it in conferences and things like that about self-care, birth and breastfeeding supporters. Like this is really becoming a thing because folks be burning out. Like you should see us at the end of August. Like Katie will tell you, at the end of August, we'd be like, no, it's breastfeeding month is over. But there's a retreat. I believe it was a like bonfire and something else last year, just to like, because who's gonna understand you better than other doulas, right? So like just I know Katie's telling me they've gone out to lunch and things like that together, meeting up at Starbucks. I think it's just you creating like a network of support. But the biggest thing is that retreat that's going on in Michigan where, hey, we all can stay a night or two together and do different things and activities to take care, doulas taking care of doulas.
Just like a community formed.
It's kind of like community fun, but it's one way to do it
Made it happen.
Yeah, I hadn't heard of that. But I would say there are definite Facebook groups. I think social media is probably the only like support network we really have. There's like doulas of Michigan and, Metro Detroit and Ann Arbor doulas. So I think just being a part of those, that's pretty much where we kind of come together to talk about events, or like Shonte said, if there's a doula who is booked for a month, hey, here's the contact info for somebody. Or actually, it was really cool. This was my favorite example of doula support recently. Remember that giant snowstorm that we had in like February? And it was wild. People were saying, hey, if you cannot make it to the birth location, everyone on this page, there are hundreds of people in that Facebook group. Everyone say what you're closest to and write down your number. And I had someone who was in early labor and I was going to have to drive an hour to get to her hospital. And somebody said, hey, I literally live across the street from that hospital. Call me if you can't get here and I'll support her for you. So, I think that is probably my greatest thing, alongside just texting community doulas that we have a relationship with and making that effort to exactly like go get coffee and stuff like that with our community doulas, because we don't have a person putting together stuff regularly, so it's just kind of us putting ourselves out there. And yeah.
The second part of the question was about equitable pay.
Yeah, that's a tough one. So, when we do our doula training, the trainer will often talk about equitable compensation, but you have to be very mindful of the area that you're in. I know of doulas in California that charge $3,000. I know of doulas, especially, in like the Flint area, charging $500. So you're going to find a huge range based on experience and location. A lot of people will say, for your first 5 births, think about your cost of doing business, think about your um, goal price for your first birth, charge 20% of that, and then second birth, charge 30% of that, and then just kind of work your way up. A lot of people too will do price changes based on the economy and based on I've been at this another 2 years, I'm going to bump my price up. But it's hard, especially recently. I was just talking to Shonte. I mean, inquiries, families are experiencing hard times, inquiries are down, or at least it is the case for most people that I'm talking to. So you definitely have to, in my experience, kind of downplay that compensation in order to serve more families. I know a lot of people, a lot of doulas, especially who offer complementary services. Like I just finished a birth photography certification course, and they're like, you need to be charging double what you're charging because imagine and they'll kind of break it out, itemized, like think about how much it would you would pay someone for 1 month of being on call, no vacations, no leaving town. Like, think about how much that's worth. Now, think about your hourly rate of being at the birth. Now, think of, and they like go through it. So, I think it's a really tough question. I think we're all kind of working through it and finding that balance between like what is accessible to families and also, you know, workable as a way to support our families. I know a lot of doulas too have a goal to raise prices and take on fewer clients. And then they make that price jump, and then the inquiries, it's crickets. And then they're like, oh no, and they back it up. So it's definitely a learning curve every time. But I would say in our area, generally speaking, newer doulas are usually around like the 700 to 1,000 mark, and more experienced doulas are usually between like the 1,000 and 1,200 mark, just to kind of give a ballpark.
Thank you for that information. Would you touch on the different types of doulas?
Okay. The 2 most widely recognized forms of doulas are going to be your birth doulas and your postpartum doulas. But there are tons of kinds of doulas. There are sibling doulas who, watch the clients, older kiddos while they're delivering. There are end-of-life doulas, infertility doulas. There are all kinds of doulas. So it's a really valuable profession and lots of opportunities there. But I would say birth doulas, that's kind of the main one that we're talking about, where we are contacted prenatally. We form that relationship during the prenatal period. We join them for the birth itself, and then follow up postpartum. And so our main role is to help them meet as many of their birth goals as possible and to provide that informational, physical, and emotional support throughout their birth. The postpartum doulas are that's like a separate training, separate certification if they choose to be certified. That one is providing postpartum support in the client's home. Usually it's contracted to be a certain number of hours, like for example, 20 hours of support divided into like 5 different days or whatever it might look like, where they're going into the home. And a lot of people think of it as like an extra amazing like mother's helper almost, where they're highly educated, they know what to look for, how to help with the baby. They can help with breastfeeding, they can wash bottles, help with pumping, take care of the family, provide a meal, put away groceries, whatever it might look like that is helping the family in that postpartum transition so that they can concentrate on their recovery and their snuggles and their feeding, and so that they have that village that they need during most often the first few months, but postpartum doulas can extend their support longer than just the initial like fourth trimester.
I have been chatting with the postpartum doula, and one of the skills that I think is fantastic is baby wearing. A lot of that fun stuff. How do you anticipate doula care in the future? Because I'm thrilled to hear that there's organizations, retreats. I'm thrilled to hear about that support. I think we hit on some of it with whether or not they'll be contracted by the hospital or not. But with an increased number of doulas, kind of, what do you think about that?
I mean, I think I already kind of touched on it, but I think it'll be more midwives. Like a lot of doulas want to become midwives. Is like I really see that a lot. I've had people message me about that. Like, how can I become a midwife? I'm like, that's not my thing. But and I think a lot of people want to become, what do I call it, Lyric? Is it traditional midwives? When you do home births, is that what I call it?
There's traditional midwives or certified professional midwives.
Yes, they
Mhm.
want to become those. I try to steer them in the right direction
Mhm.
with the information that I have, which I feel like I can respect that. If they rather take that route. One of the things that I see that's been going on more recently are doulas. I hate to say it, but I think people should be educated about it, doing unassisted births where there is not a midwife. I've gotten quite a few more inquiries from moms who are like, no, but I want you to do the birth. I'm like, no, 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 no. What you mean do the birth? I will be there at the birth, or do you mean? But when people make it clear to me that they want me to do the birth, I let them know that I'm not the doula for you. I don't do unassisted births. Doulas out there who are listening, don't do unassisted births. You don't want to be that person and then something happen and that's going to be on your conscience forever. So I'm hoping in the future that more people, I know you think you do a lot of the work before somebody comes and catch the baby. It's a lot that goes into catching the baby and everything else. So I respect, physicians, I respect midwives. You do what you do and I do what I do. And so if you want to do it, to make sure that you take the proper channels to do it correctly. So I'm hoping that this doesn't continue to be a thing with the unassisted births. I think we need to make sure in doula trainings and mentorship that we make sure that people are aware not to allow this to happen. Now, if you accidentally catch a baby, Katie done caught a baby before. Like if you accidentally catch a baby because nobody could get there in time, then that's something different.
That's
But
different.
let's not have it planned.
Well, when I'm hearing you say that, what's going through my mind is women must feel safe with you if they want you to catch the baby. So if we can have a situation of safety where women feel supported by their provider, whichever one that is, maybe we can decrease the requests for that. Go ahead.
Why are you trying to provoke me? No, I was behaving myself. I do think it has a lot to do with it because people say that they don't feel safe. I still tell them, if you don't feel safe, I know A, B, C, or D. I'll be like, Lyric is a lovely midwife. You might not get her for your birth, but it's a slew of them. And I would go with them. Or people who specifically want a Black provider, I tell them who to go to. There's ways I can make you feel safe as a doula that doesn't involve me catching a baby. And that's the thing. And that's the thing that I always stress to people because there's so many new people out here in the field. You still, and I understand being new and you getting your foot in and you want to get the clients, but even knowing somebody that's trusted, and if you ask me about the new person and that's who you decided to go with, I can tell you like, oh yeah, go with that person. But I mean, I also know who's out here doing unassisted births. Like the streets be talking. Like, and the other thing too is also who you do your home births with as midwives, because even though they're trained in those things that Lyric talked about, there are some home birth midwives who aren't safe people. I'll say that. And so you also want to watch, like, that's why I always tell people ask around in the community about what's what and who's who. I'm a person who will tell you the truth. And I tell you from the best space of you being safe and you getting the goals and outcomes that you want. If I'm over here and I know such and such has had how many deaths happen in birthing situations in home births, I can't in good conscience just be like, because out of professional courtesy, not say something to you. Oh, but you can tell. That's why I said talk to trusted people. You can tell who's shifty. Like, because it's not the norm. But I will tell you this. Fair, yes. But I think like after you do oh so many births and you see who you birthing with, you can catch a vibe and you know like, oh no, you not safe. Like if you finish in a C-section in 5 minutes, what's really good? Like, you know what I mean? Like those types of things that you want to pay attention to, that you start to have knowledge of, that's not a provider that I feel would be safe for you. So I think those are things that we as doulas still pick up in a room, because it's some people I never birthed with before, and then I birth with them. I'm like, I will never tell nobody to go back to you. So yeah. Oh yes, definitely some facilities. So yeah. So I think it's just learning your community, definitely. So
But I'm thinking as you're talking about homebirth midwives have traditionally had a relationship model of care. And I think that's where all providers need to be moving towards, because if there's a relationship model of care, then there's a level of safety and of acceptance and being able to talk about maybe some risk factors they have that they've been ashamed to bring up. So that's a new movement kind of at the ground floor level right now, which I'm excited about because we need that in our hospitals. It's definitely patient-centered approach. It's something I volunteer at a free clinic, and we are all about relationship care. And we have people who will tell us things that they didn't tell their provider, or the barriers that they have. We see them more as a person without a car, and how can we get you there and hook them up with the system. So that's what feeds my soul. I love my midwifery care at the hospital, but I'm so excited for to do and maybe promote this relationship model.
but I will say, and I'm not showing favoritism, but it's the truth. I refer people to the midwives a lot because I know they provide a certain level of education during appointments. So I tell people all the time, like, what are you looking for? Because if you go to the OB, shoot, I didn't have OBs. I got 4 kids. I know it's like real quick. I done waited for about an hour and a half, but my appointment like 5 minutes. Like, but everybody who I've had who had the midwives felt like my appointment was like 30 minutes education. Like I really got to talk. I really felt heard. I got to ask all these questions. It was a totally different experience. Like when people tell me they want to experience, I say go to the midwives.
And that's a good point too for people maybe who haven't had a pregnancy yet. Tell them to seek out prior to because once you're pregnant, you've got a ticking clock of things that are happening fast. So it's exciting to think that people might be able to take the time to get to know a provider prior. So how can the community become more involved in the Maternal Child Health Network initiative?
At the MDHHS Doula Initiative, yeah, that's fine. I wasn't sure. I thought there was one question that felt like it was directed towards the hosts, so I didn't know if that was it. Yeah, so we have a few different ways. I mean, they're your kind of your traditional ways. We have a website that people could visit. It's www.michigan.gov/doula, and I can give all these to our hosts who can send them out. And then we also have a doula listserv that we've created. You can join it from the website, and that's how we'll send out any updates as far as trainings, continuing education, updates to the Medicaid policy, like tips and informational for people that are trying to bill Medicaid and be successful at that. And then we also have the Doula Advisory Council that, that council is set at this point, but it's a 2-year term. So at some point we will be putting a call out for doulas statewide who want to be involved in the council. And so if that is of interest, you could certainly apply at that time. I think those are probably the biggest ways.
Any other questions from the audience? Can I ask the audience, what brought you here? What was your hope or your goals of being here? Anyone want to speak up? You're looking for support for you. Oh, that's beautiful. Thank you. Yes. Very nice. Oh. Love it. Jan? Mhm. I'm so glad you're here. Any comment back here? Oh. That's beautiful. We're so glad you're here.
She doesn't have any items. That's why we're here. Congratulations, make me come. I'm on my way. I'm on my way. Oh, thanks. That's so sweet. I overlooked it. Please, guys, but thank you. It's really hard, you know, to run a business and be a mom and both on Facebook. It's hard. What? They have to. But yeah.
So I was impressed when I first met you because you transitioned, not to out you, but like you were an amazing presence at the hospital for someone that was no longer going to be able to have a home birth. And
I was so appreciative. That was my first transfer as the midwife and not. I had a handful of really good experiences. Exceptionally poor experiences. Definitely touchy feeling coming up with the plan. But I never let the work over. He went out of the way. And then also the
Mhm.
God said he is after you and that's the support of that was hoping that it continues for that.
Definitely clap. Thrilled. I think we talk about relationship-based care, but I think we need to have interprofessional care. So,
Feels like you guys are all connected. I know. Yeah, one way or another, we have all met somehow.
mhm. So how do you think this will impact your patients at the Hamilton Clinic? Mhm. For sure. Well, any last comments before we wrap it up?
No, I was just going to add to what she said. I think that like in the birth community, we all have these interpersonal relationships, but I would say in the community, a lot of people still haven't heard of doulas. And so I appreciate that, especially in like professional realms, there are people here to kind of learn who can then spread the word, because I can't tell you the number of times that I've had like usually a mom inquire and then we'll do like a meet and greet and the dad is like, you're a what? Or like I've never heard of that. And it's kind of fun to get to provide that little piece of education. But I think the more that community members are aware and kind of spread the word, the better. Because Lyric, you asked, how can I see community doula care looking like in the future? And I think that has a lot to do with it, because I think with added visibility through like MDHHS and the Michigan Doula Initiative and stuff like that, I think that helps. I think providers recommending doulas, I think clinics recommending doulas, or even like, it sounds silly, but even people who have any sphere of influence, sharing Facebook posts or small business support, it makes a huge difference. So I think just spreading that awareness and getting the word out. Yeah.
I love it. All right, well, thank you everyone for being here. Thank you for hosting. Thank you to our team in the back. I'm going to grab that one since I do that in my professional realm. I try to get a gathering of when I'm talking to them, what's your expectation of a midwife? Because I want to be there with you, but I also have some other responsibilities, gathering things, making sure there's a safe environment. So I say to them, if your goal is for someone to rub your back or to be present or to be whispering in your ear, give your husband or your partner a chance to go to the bathroom or grab a bite to eat, then you really want a doula. And we go through what is a doula? And I kind of talk to this professional labor support. Like there's a aspect I won't be able to provide for what you're interested in. And we have a small collection of names that I know of because we know of Katie and Shonte, but I would love a more comprehensive. So if there's a doula list, that would be incredible to be able to offer to patients. So I try to let them know that it accents the husband, it doesn't take, or the partner, it doesn't take their place. And I don't want them to have expectations of me that I won't be able to meet, because how many times do we have a baby? And I kind of talk to them like we have these big weddings, right? We spend hundreds of thousands, not hundreds, but you see people spend thousands and thousands on a wedding. And I'm like, wedding schmedding, you're having a birth, you want to have the birth because you might only have a few or one. So that's kind of how I address to potential clients of doulas.
Hear, hear. I think a lot of it too, you really have to, as a doula, be very like forward thinking with the questions that you think people are going to ask, like Lyric said. So in my process, after someone inquires about my services, I'll do a meet and greet, and I have this little like welcome packet that I go through, and it kind of covers a lot of those questions that people are going to ask, like, will this take my partner's place? Or what are the benefits of a doula? Or what does it really look like in the birth space? And I think that makes a huge difference, because I've heard a lot of people say, well, there are only two of us making the baby. I just want two of us in the room having the baby. And they don't realize that, depending on their birth setting, they might have a lot of new faces coming in, and they want like a familiar face, and that can be the doula. Or I'll kind of outline different scenarios where I'll say, kind of like Lyric said, like, well, if you're in a hospital setting and the cafeteria is closing, and your husband or partner needs a chance to eat so they can be their best selves to support you, do you want to be alone in the room, or would you rather have a doula? Or we, in one of our prenatal visits, I'll teach the partner comfort techniques so that they are really confident providing like some of the hands-on support during early labor, like before the home birth midwife arrives or before they head into the hospital, so that the partner feels really comfortable and confident being that main support person. Or I'll talk about, like, for example, let's say the partner's holding your hands, sitting in front of you, telling you how great you are and motivating you, coaching your breathing, while the doula's behind doing like some sacral pressure to relieve that back pain and stuff like that. So I'm very like specific. I'm, encouraging them, showing them what a doula provides prenatally and in the birth space, so that hopefully that answers some of the questions that they have and kind of sees the value of it, because it's so unfamiliar. So I think a lot of people are like, oh, and then it sparks a new conversation.
I just wanted to add, don't you find that a lot of times the partner and something all
Yeah, for sure. Mm-hmm. Yeah, absolutely. And Yeah. Yes. Yes. And you never know what kind of support they want to be. Like if they are looking at you and you're giving a thumbs up like yes, this is normal and they feel reassured, or you're showing them squeeze with this amount of pressure in this spot and then they feel useful or whatever role they want to take and we can help facilitate that. I think that's yeah, for sure.
Yeah, I was just looking at, a lot of times, dad and dad have a team, and you would have a lot of, going through a lot of different situations, experiences, you have a level of comfort in their space. Where the dad is watching, like, potentially you're going through a really big, transition, and it's difficult, and maybe you're kind of and the good will come through.
Thank you for adding that. Did you have something to say?
Go ahead.
Oh, Shonte, I didn't even.
Um, I was gonna add to what Katie was saying about the dads. I was gonna say, like, if you were educating, like, say your patients or whatever, and they were thinking about a doula and dad was there, I always suggest to the mom when she reaches out to bring dad to the interview. Cause I'm like, I don't wanna meet him the day that you delivering. Cause like, how uncomfortable is that? And he's like, who are you? I think at the height of the pandemic, it was like, I want a doula because my mom can't make it and because you now count as part of the healthcare team. And so I think that gave couples an option to just have a lot of women were saying they wanted another female presence there that just wasn't the nurse. And then the other thing too is like how she was talking about dads and making them feel apart. Younger dads are hilarious. I had a younger dad and he was like, but why? But why should I really do this? And I was answering all the questions and I'm like, I'm here for you too. Like, I'm not just here for her, I'm here for you too. And he was like, okay, as long as you know I'm Michael Jackson and you Tito. I was like, I got you. I'm like, I'll be Tito. Like, so just like he wanted to feel like I'm still dad in this space and you. I'm like, I got you covered. Of course it all worked out, but even so, even in moments where the birthing person might start getting a little feisty. I've had times where I've had to pull dads to the side. You're awesome. It's just the labor talking. Like, she really didn't mean that when she threw that at you. She didn't mean what she said. Like, you go take a walk and like one dad, he was still mad even. I had to be like, you still not mad. And even taking pictures for them. Like I take pictures like Katie does. We like are all about our photos. But like even like you enjoy the moment because what dad's usually trying to do or the support person, they're trying to take pictures because she can't take the photos. So being able to take photos during the birth and let them enjoy the moment, people don't think about that aspect of doulas too. I don't have to enjoy the moment. I've dropped a couple of tears a few times, but this is your moment and I want you to really be able to embrace it. So people don't think about those aspects of the birth either.
Okay, sorry, just adding to that too. I know you're probably trying to wrap it up, and here I am like blah blah blah. But I would say too, with regards to like the partner, we're also kind of giving them space to process. So like a lot of the times in the birth space, especially if they're facing some sort of decision, the doula will kind of pause and be like, okay, so and so, what do you think about that? And like in my head I can even use like that brain acronym, like what are the benefits, risks, alternatives, your instincts, and what if we do nothing for now? So like we provide that opportunity for informed decision making. And I find that like the mom, she's in labor land, she's like totally in the zone. And the partner is the one who wants a second to like wrap their head around something, and the doula can be like, hey, so and so, would you like 5 minutes to think about that decision? And then the partner's like, oh, good. And then they have that space to kind of talk and discuss and make informed decisions along the way. And they're always thankful for that too. And then I had one more thing I was gonna say and I lost it.
Keeping dads from fainting.
Oh yeah, providing chairs if they look like they're gonna pass out.
Like maybe I think you should go ahead and sit over there instead of looking down that way. So yeah. Yeah. Sometimes we catch that because you can see them about to go down. So yeah.
This has been a lot of fun. I'm so happy. Thank you, everyone, for being here and the panelists and for all that you've done through the Medicaid getting reimbursement. That's wonderful. And thank you for supporting women.
I'll take it. She see